And what you see by way of the public education video that has just been sent to you, even not broadcast to you, is all because we do have guidelines that have trickled down. First, the WHO having these guidelines adopted by various health services, if not authorities. And in Ghana, the Ghana Health Service and then the Ministry of Health or the Ministry for Health, they have been in a position to be able to disseminate this type of information, but also available on the internet and also on YouTube. Talking about YouTube, you can always watch us live through Major Online TV, but also as we're on the DTT now, we're free to air. But in the meantime also, related to all these conversations about how we need to use these sanitizers, the food that we eat, etc., we're coming to have a string of conversations on the subject. Now let's tell you about how Ghana's case now is said to be at a locked number of 68 amid calls for a total lockdown. But how we tend to not only congregate or aggregate at meetings, etc., will be a main thing we have to discuss. And how we handle food, etc., is important. For example, we're told that sanitizers should always be on us. We carry it in our bags with us so that we tend to use them. And since this outbreak, we've seen a number of sanitizers on the Ghanaian market. The question then we started asking was, are these sanitizers, many of them homemade or perhaps made by small startups, effective or efficacious? So we do know there's been a survey or research done by a UDS microbiology department, and we're going to speak to one of the lead researchers to get to know what their findings were, how we can relate their survey report or their findings to what is existing on the markets. And Dr. Courage Saba is going to join us. He's a microbiologist. And thank you for joining me, Dr. Saba. How are you?
I'm fine. And you?
I'm great too.
And,
okay.
Yeah, good morning to your listeners as well. Good morning to you.
Now, Dr. Saba, if we take a look at the states on the use of sanitizers, generally, what should be the norm? What should be the right mix of a sanitizer in the first place, before we even get to go into your research?
Yeah. So the WHO has a recommendation, several recommendations of the ingredients that must be used for sanitizers, because we don't have all ingredients at the right quantities in every country. So they have a lot of mixture of ingredients. So based on that, the major ingredient or active ingredient in the hand sanitizers should be alcohol, which is 70% and above. In some countries, they'll say 65%, but 70% and above of alcohol is the major thing that must be in the hand sanitizer.
Mm. And you decided, your department, you call your department the microbiology department? That's the name?
It's biotechnology department. Department of biotechnology.
The Department of Biotechnology of UDS.
Okay.
So what then might have interested you for you to decide that you wanted to undertake this observation or survey?
Yeah, but we all know the situation currently. And since the president and other bodies call for the massive production of hand sanitizers in the country. And since then, a lot of people have been trying to produce their own hand sanitizers at home, and people are diluting alcohol, people are mixing things without knowing the right percentage of alcohol they are using for the production, and even they don't know the right percentage of alcohol after the final product, which is very, very crucial to killing this virus. So we as a department we thought that we should carry out something to also to carry out this research to also help Ghanaians realize the most effective sanitizers, and also recommend to all the authorities involved to take action so that we'll be able to have the very, very good sanitizers, which will be able to kill the virus and other microorganisms on our hands.
And subsequently, you found out some interesting results. What were they?
Yeah, so in line with that, we sample hand sanitizers, alcohol-based hand sanitizers from 5 cities in the country, from Kufuoredua, Kumasi, Accra, Tamale, and Bolgatanga. In all, we sampled 28 different brands of sanitizers. Then we also add local akpeteshi that they sell in the bars of Tamale, 6 bars. Then we also included 6 alcoholic beverages. That at times they add even roots of trees and the rest, so that we'll be able to find out whether these things really have activity against microbes. On the sanitizers, out of the 28 sanitizers, different brands that we took, we realized that 54% did not have activity against microorganisms at all. We found that 43% had very little activity against microbes. And 3%, only 3% of the sanitizers were very, very, very effective. And I must also tell you that we didn't just do this in the lab. We went further to swab the hands of 50 people using hand sanitizers. What we did was to ask them whether they use sanitizers. Then on the spot, we asked them to use the sanitizers, how they use it, how they normally use it. Then we swab their hands just to see whether after the usage of the sanitizers, there will still be microbes on their hands. Mind you, we did this and we had, out of the 50, we had microorganisms on 49 of those people who used the hand sanitizers immediately after just 5 seconds, then we swab. They all had microbes. And there was one that we didn't find any microbe. What we realized was that that person was using one sanitizer that was very, very effective in vitro, that's in the lab, what we conducted. And that resulted in activity on the person's hand. That means that sanitizer is really very, very effective, at least against the test organisms we use for our experiment. I must also say that there are a lot of factors that come into play when you are using even sanitizer on your hand. Sanitizers generally, they last for only 2 minutes on your hand. Alcohol-based sanitizers, they last for only 2 minutes on your hand after usage. So if after 2 minutes you still can't touch anything, you have to apply the sanitizers.
Okay,
because people think when they use the sanitizer, they can stay for maybe 1 hour before they use it again. But that is not true. Once you touch another thing, there is a likelihood of microbe stain on your hand, because it is very, very effective only after within 2 minutes on your hand. That will kill the microbes within 2 minutes.
Now, so your advice then is that because the sanitizers and their efficacy would always stay on your hands only within the period of 2 minutes, you would always then need, if you have touched surfaces, interacted with people, etc., to keep using them. In an hour, it means that approximately you're expected to use it about 30 times, if not just a little less.
Yeah, if you are touching a lot of things. If you touch, yes, you probably might have contaminated your hands with microbes. But if you do it and you don't touch anything, definitely you may not have anything on your hand.
What then can we do by way of remedy, knowing that we're in dire straits? People need to improvise. So, for example, we have companies producing Danadams, Casapreco, etc., all trying to improvise their production lines and produce. But you go outward Accra, outside the boundaries of Accra, Kumasi, etc. People living in areas like Cape Coast, Takrade, living in Tamale, living in Wa, etc., and the other communities, if not the nook and cranny of Ghana, would need sanitizers. People would need to improvise. Startups would need to do that. What would be your best advice by way of the mix?
Okay, thank you very much. I forgot about the results from the Akwetishi and the local genes that we also tested. I must say that they were not active against microbes at all. They didn't kill microbes at all, not effective. So the Akwetishi and the local genes that we have packaged in sachet, they are not killing microbes at all. I said it because Takrady, I learned there is a shortage of alcohol there because of lack of sanitizers. Now, getting to my recommendation, we need to first know the composition or the percentage of alcohol in the ethanol we are using. Because if we don't get the right percentage, there is a likelihood that the calculation may not be done well. Because, for instance, those producing this, some of them cannot do calculations, simple, they may not do simple calculations. So my advice is that we have this gadget that is called alcohol meter. Alcohol meter is almost $12, which I even ordered for $12, that you can use to check the percentages, various percentages of alcohol in the ethanol being used.
Okay.
So moving forward, we can obtain this alcohol meter for all our regional offices. I don't know whether they have all our regional offices of FDA, so that at least they use this to test the alcohol before even approving the producers, and also check the final product and make sure that they have 70% of alcohol in their final product. It is not very difficult. It is not very difficult. If we make sure that the alcohol we have is 70%, fine. And I must also say that people are putting on their labels that their sanitizers can kill 99.9% of microorganisms. Please, if they have not done any calculation, they better don't state that, because currently, as we stand, there are companies in US that are being sued for putting that on their label.
Okay. We know the feed is going a little bad, but
because
but but but, but
they are deceiving the general public than any calculation. They not
was it? Well, we have some poor connection. But
hello.
Dr. Saba, we will come back to you. But look, let's get onto the phone lines because Dr. Saba is still online. Well, we will get back to him. But we decided to get into this conversation with the FDA because the FDA, that's the Food and Drugs Authority, they supervise, regulate, they check the content of these sanitizers on the market. So Emmanuel Nkrumah, he is head of the cosmetics department. Mr. Nkrumah, good morning and thank you for joining me. But when it comes to the sanitizers, what processes do you go through? What kind of regulatory regimes do you go through before their approval?
Okay. Good morning, and I want to greet all our listeners. Thank you for the opportunity as well. When sanitizers are classified as household chemical substances, and when an application I mean application, the form for the product, the samples of the product, the label, and then the requisite fee are paid. And when it's submitted to the FDA, then samples of the product are sent to our quality control laboratory, which is ISO accredited. And when the results come from the laboratory, that is when the label assessment, if there's a correspondence or correlation, that's when the product is approval. So as we talk, all the products for the past 2 weeks, about 80 locally manufactured products, mostly, that were approved or that have been approved, have gone through this process to assess the quality, safety, and efficacy of this product for was given.
So does it mean that it is because your approval processes are rigorous, so perhaps it discourages producers, and especially in times like this when many startups are producing because the demand is high, from going through these processes to get the right sort of combinations by way of the chemical compositions for approval?
Thank you. That's been accurate. As we talk, because of the emergency and the crisis situation that we find ourselves, we realize that with the COVID-19 announcement of it now, sanitizers, there was a shortage of the market because of the mad rush of people to get hold of these products and use it to protect themselves. But as part of the measure of the FDA to help save the situation, there has been an emergency meeting, and the FDA has a COVID-19 committee that is assessing and processing all applications that are submitted to mitigate the COVID-19 situation. And for the sanitizer, we have 24 hours, maximum 48 hours to process this application. So for products in even the household category, almost all the products are on hold, and everything is now geared towards the processing of applications for sanitizers, antiseptic, disinfectants, and the like. So there's not been any delay in this process, and we are constantly informing manufacturers to even produce more of these products so that a lot of them will be on the market. And we are also sampling products from the market, and the ones that are not registered, what we are doing is to call the manufacturer, because if they are trying to put something out there to help the situation, you don't stop them. We pick the samples, we analyze them, then we encourage them to come submit the application forms, make payments, so that more of these products will be put on the market for Ghanaians to have access to them to protect themselves.
What would be your best advice? Because we just spoke to a microbiologist with the biotechnology department of UDS, the Nyakpala campus, and Dr. Saba is saying that it looks like the demand has also meant that people would need these sanitizers outside the main capitals we have, Accra, Kumasi, and let's say Tema, etc. And so how would you then assist these startups to be able to get the things right, instead of just saying that the applications are rejected?
Thank you, my brother. No application is being rejected. People are rather encouraged to be producing or putting more of these products on the market. And the applications that we've received for the past 10 days or more, it cuts across the entire country. We have products coming from the north, Tamale, Upper East, Upper West, the North region, Ashanti region, all over the country. And as I talk to you, from last week Monday up till yesterday, more than 80 new products have been approved. And anytime we approve them, we update the list. And this list is all over on the social media. And majority of these products are locally manufactured. That's the exciting thing to know. So our local manufacturers are putting these products on the market. So there's nothing like shortage. And if I have seen the publication that's been out there by Honorable Professor or Doctor from the UDF, you see, this document, I must say, is really inaccurate. And rather than encouraging people to do what is right, yes, it's in his right to put a document like this. But when you do that, it has to be accurate and it has to be the truth, so that we don't put that into the eyes of Ghanaians. You see, the objectives of this document indicates that they are determining the bactericidal activity of alcohol-based sanitizers and septic and the like on the Ghanaian market. Now we are very critical because the alcohol content also determines how it's going to sanitize the hand and also prevents the bacterial growth. And from the next one, it's also to check that registered alcohol-based sanitizer and antiseptic on the market. You see, FDA has that mandate to do that. And if you want to check, we have a list that we publish as and when these products are approved. And these products are also on the market.
Right.
So you don't check with the FDA, then you put this out. And the first point, if I go back to the first point, that assessment of determining the bactericidal activity, normally there are protocols that one has to follow. How the sampling is done, where it was done, and when it was done. Right? What sample size did you use? What media did you use? The strain organism. Right? Whether this strain is characterized to specifically indicate that this particular organism will exhibit this characteristics and not maybe another organism that's giving you a false result, right? The media that you use, what was the sterilization process? Because if it's not properly sterilized, you have other organisms which are not expected growing from the media. You see, and the media, the result that you get, what is the inhibition zone, right? And what devices were used to assess or calculate or take up the result from what you are getting. You see, these are all things that you ask. And before you put out a document like that, there has to be a peer-reviewed document. All these questions are answered so that it becomes relevant to all of us. Then we take a cue from it. Because all that we are doing is to the best interest of the Ghanaian people, to protect ourselves, so that we can go around to do what we have to do in the interest of God and country. So some of these documents, yes, they are good, but it has to be shared with the relevant authorities so that input will be made, so that there are no loopholes and the like.
Right.
And
Mr.
if you talk of the fees, let me add this one as well. Hold on, let me add this one as well. The fee is not expensive. With the majority of the application coming in, we put them into the quoted category. And the registration fee is 3 years, and it's 300 cedis. But to facilitate, we are registering for the first year, and the fee we are taking is just 100 cedis.
Oh, fantastic. Mr. Nkrumah, I love this part of the education you're giving us, and we all need to complement the state and the media's education as well. So, again, just to clarify, you're saying that so far you have about 80 applications, don't you? You said so far you have 80 applications, don't you? Okay.
Hello?
You said so far you have 80 applications or have approved 80?
No, we have approved 80 plus. It's more than 80.
Wow. Wow.
Because as we talk, our database currently has over 100 hand sanitizers with the right alcohol content. It's ethanol. If the minimum is 80% ethanol, and if it's isopropyl alcohol, the minimum is 70% isopropyl alcohol. Yes, and I must also emphasize, people should also desist from using methanol and methylated spirit as sanitizers. They are not made to do that. So it's a petition. Because methylated spirit is not supposed to be ingested. It doesn't have to go into the mouth. It's very dangerous and very toxic.
Right. Well, thank you very much. This conversation has been immense by way of the great knowledge so far we've been able to deliver to our viewers. But we have to thank you, Mr. Emmanuel Nkrumah, Head of Cosmetics Department, the Food and Drugs Authority. They are the main regulatory agency. And then from the Biotechnology Department of the University of Development Studies, microbiologist, Dr. Saba, also sharing his research findings and his thoughts on the state of sanitizers. But it's good that the FDA is doing what it's doing. But we also do know that the counterparts in South Africa have been doing some great work. Now, talking about South Africa, we have to take you through, the cases that they have. We'll go to a state. As at the beginning of March, they almost had, barely 10 cases. And they've climbed up by the 25th in the region of close to 800, above the 700 mark. It speaks to how serious the coronavirus infection is. And we also do know just about 2-3 days ago, we had Cyril Ramaphosa, the president of South Africa, calling for that total lockdown. And it means that we have what it is. 17th of March, first confirmed cases of local transmission were announced by government laboratories in Gauteng, 3 in KwaZulu-Natal and 1 in Western Cape. And then also before then, we had a number of cases. Initially, just like many of the related countries in Africa, many of the cases were coming from outbound. They were coming from not those countries, but from the infected countries in Asia, in Europe, and coming into Africa. And there's the same situation that South Africa also recorded. And now this is the situation they have. As at today, they have 709. Look. The president, on March 23, Ramaphosa, addressed the nation and announced a 21-day lockdown, effective midnight of today. And this will go on to April 16. It will mean that there will be the deployment of South African National Defense Forces to support government in this crackdown. And if they tend to regulate, it would mean that there will be times when people will be asked to go out, etc., or do their grocery shoppings and all. And if you're flouting those regulations, some punitive measures will come towards you. We had our own correspondent, our friend in South Africa. He is the editor of the Guardian and Mail newspapers, and he has been helping us to analyze the South African situation. And Simon Allison is here. Simon, how are you? And good morning. How do you feel yourself? What's your state of health? I have to first ask.
Good morning. I am fine. I'm in good health. Thank you for asking. I have actually just returned from the grocery store myself. And it was quite a surreal experience because although people have been told not to panic buy, and I think it's fair to say that most people are not panic buying per se, but they are stocking up. We've been told there will be this lockdown for 21 days. Of course, people are nervous. They want to make sure they have essential supplies. And so there are long queues of people waiting outside the supermarkets. And most supermarkets are enforcing one person has to leave before the next person is allowed in. And there are limits on certain essential items, such as, rice and pasta and that kind of thing. People can buy 3 at a time. These are informal limits set by supermarkets, not regulated at this point. And people are generally pretty nervous. The economic implications of this shutdown are going to be incredibly severe for the country. And I think everyone's worried for their livelihood. They're worried about what comes after the 21 days. So it is an atmosphere of uncertainty and nervousness. At the same time, I think South Africans are generally quite relieved to see their leadership taking such severe and quick action to confront this coronavirus pandemic. And certainly the leadership in South Africa seems to be a level above what we are seeing in other parts of the world.
But is there a situation, because South Africa is, I'll say, a developed country, in a sense, comparatively, and as a result of that, this was expected? And so...
Absolutely. We knew this was coming. We have extensive international air links and close air ties with North America, with Europe, and with Asia. So, of course, we knew this was coming. And I think we are trying to prepare for it as best we can. South Africa has implemented these strict lockdown measures, which are similar to measures we've seen in Italy, in Spain, in the United Kingdom, and in certain states in the United States of America. But we've implemented them at a much earlier stage of the pandemic, of the spread of the coronavirus in the country. Cyril Ramaphosa need to get this under control to make sure it does not spread further into the rest of Africa. For the
parts or the cities of South Africa, or the big areas that tend to look like Europe, the United States, China, etc., where we have proper demarcation of buildings, people live structurally, they are better demarcated. It looks like health officials will have no difficulties. Where they would have will be the slums, right? And is that a worry for the health officials and even you as a journalist, based on your observation?
Absolutely. It is a huge worry. South Africa is one of the most unequal societies in the world. And generally speaking, if you are wealthy in South Africa, you can get all your needs looked after. And I think that there is certainly a perception amongst more well-off South Africans that they will not be affected by this virus. I think that is a mistaken perception, because as we've seen, the virus can hit well-off countries and no one is safe. But certainly health officials in South Africa are extremely worried about what happens if and when the coronavirus reaches informal settlements, which are much more densely packed and where it is very difficult for people to self-isolate because of their socioeconomic conditions. And I think that is partly why this crackdown is so severe. It is an attempt to prevent it from reaching informal settlements, to prevent it from reaching rural areas where healthcare is not so good, and to nip it in the bud before it gets there. And I think we're only going to see in sort of 21 days whether these actions have been quick enough and effective enough.
A lockdown, what really does it mean? What should the world be observing from the South African lockdown?
It's a great question, and it's a question that ordinary South Africans are asking themselves, and I'm in a few WhatsApp groups with my friends, and we're all trying to figure out what exactly does this lockdown mean? Are we allowed to go for a run? Are we allowed to take the dogs for a walk? Are we allowed to, socialize with small groups of friends in small numbers? And there is still a lack of clarity around this. And I think that has been one of the government's flaws in its handling of the crisis. I mean, yesterday we had two ministers address the practicalities of what the lockdown means. One minister said, yes, you can go for a run, you can walk your dogs. The other minister said, absolutely not, you must be staying at home at all times. So these mixed messages are very dangerous, and I think that the government needs to get its communication strategy on the same page very quickly. But in general, at this point, I think that the main fear that South Africans have is whether the food supply chains are going to be remain intact. Are we going to? The grocery stores are open; they will be exempt from the shutdown. But are they going to have the supplies they need? Is that those supplies going to be consistent? Can we get those basic goods? And so far, industry captains and government have assured us that there are no issues with supply chains and business will continue as per normal.
And I'm just reading from your paper, the newspaper that you edit, and it's very simple. And this is the Guardian. And it says, I'm reading this to you, Simon. It says health workers, emergency personnel and security services will be allowed to work, while soldiers will be deployed to patrol the streets in support of the police. Now, if I take a situation like that, it will mean that a total curfew. Is that the situation, just like the way your newspaper paints it, what we expect to see from today?
This is what the president announced. You know, these are the measures he said, and we're trying to figure out exactly what this means. My suspicion is, yes, this is a total curfew. I think that the public health advice is that people should not leave their houses unless absolutely necessary, and that includes taking your dogs for a walk or going for a run. It's best for people to just stay at home and not to socialize. You know, use the 21st century technology to connect with your friends and your colleagues, etc., etc. That is certainly the intention of what the government is doing. Now we get to the practicalities. And of course, there are going to be vast numbers of people who are essential services, you know, supermarket workers, bin collectors, people involved in the production of food, people working in healthcare facilities. These are not small numbers of people. How do they get around the country? You know, public transport is mostly shut down. All our minibus taxis have been told to stay off the roads. So if you are a nurse living in an informal settlement, how do you get to the hospital? All these questions we don't really have clarity on as yet.
Yeah.
And I think that's the really difficult ones that emerge in the first few days of the lockdown. It will be trial and error. I imagine there'll be lots of errors in the first few days, but hopefully we'll get it right.
You seem to know somebody, you seem to know what will be gotten right or get to a better perspective. But I don't know whether you know Ghana or you visited Ghana before. You use, let me borrow from your lexicon. You said informal settlement. That would mean where we have the slums, aren't they? And we have slums here in Ghana too. We call them Nima, Fadama, Sukura, and also Ashaiman and the rest. Now, they are a replica of what you find in the slums in Soweto, etc. If there are people here in Ghana calling for some lockdown of a sort, the Ghana Medical Association has issued a statement of a lockdown. Do we know what we should be preparing for?
Look, I don't know if anybody knows what this really looks like. This is an unprecedented experience in you know, living memory of humanity. We haven't been through this. This generation of people has never been through this. And so far what we've seen is lockdowns happening in highly developed countries. You know, we saw in China where it was enforced with very sophisticated technology and an authoritarian state. We've seen it in Italy and Spain and the UK, etc., where those governments are trying to enforce it and it's actually not doing a great job, because these are democracies and people think that they can do what they want. And in a case like this, these are questions we have to ask ourselves.
Yeah.
Can people do what they want?
Right.
So I think South Africa is vitally important for the rest of Africa, and frankly for all developing world countries to watch, because as you said before, we're in that sort of middle ground. We are developed in some ways, but we are less developed in other ways. And so the South African experience in places like Soweto and Alexandra, in Joburg and Khayelitsha, in Cape Town, that is going to be the experience that many slums and informal settlements, that's what's going to happen in other parts of Africa. So I think African governments and policy makers need to be watching South Africa incredibly carefully and learning from our mistakes and learning from what we do right, because this is really the test case for what's coming next.
Okay, just 10 seconds. What have you been eating to keep healthy? Just 10 seconds. 10. And I'm counting.
Well, we've stocked up on fresh produce. We've got a lot of pasta and rice, but we're hoping that the supermarkets will be open and we will keep getting fruit and veg that we need to stay healthy.
Thank you very much, Simon. And Simon Arlison is the editor for The Guardian and the Mail newspapers in South Africa. He's been helping out with some great conversations. And Simon, have a great day. We'll touch base with you again tomorrow in that same house of yours, and we'll get to know how the lockdown is going on. But I just asked a question about what you need to eat and what he is eating, and I tell you, it's our next conversation. Mama View also has got it all locked down. I mean, we've locked this conversation down. We're telling you what you need to eat to make sure that you build your immune systems, you know, get muscles like me, or have some good genes, etc. All coming up next. Stay with us.